Diabetes mellitus is a metabolic condition which is characterized by the buildup of glucose in the blood due to the inability of the body tissue or the body cells to pick up glucose molecules from the blood. Now, diabetes mellitus is classified into type 1, where there is absolute insulin deficiency, and type 2, where there is poor sensitivity of the target cells to insulin. The pancreas is made up of islets. These islets are called the islets of Langerhans. The islets are surrounded by pancreatic acini. In the middle of each acinus is a duct. The islets of Langerhans is composed of alpha cells, beta cells, and delta cells. In type 1 diabetes mellitus, there is destruction of the beta cells. Now, the beta cells express glutamate decarboxylase. In about 80% of patients with type 1 diabetes, antibodies are formed against glutamate decarboxylase. Also, the beta cells could be destroyed through infiltration of the islet tissues by T lymphocytes as well as autoantibodies. These autoantibodies involved in the infiltration of the islet cells are the islet cell antibody, also known as ICA, as well as insulin autoantibodies, or IAA. This process of infiltration has a great genetic component. Therefore, a genetically predisposed individual could form islet cell antibodies against the islets of Langerhans, as well as insulin autoantibodies against the insulin release, which is going to prevent the release of insulin and therefore diabetes mellitus. The islet cell antibodies in some cases could be detected years before onset of the disease. Now, the formation of antibodies against the body tissue manifests as autoimmune disease, which causes destruction of the beta cells. Now, this is mostly triggered by viral infection in genetically predisposed individuals. In this same group of patients, viral infection alone is capable of destroying the beta cells, and the destruction of the beta cells causes absolute insulin deficiency, and therefore target cells of the body will not be able to pick up glucose molecules from the blood since there is no insulin to sensitize the target cells. This would lead to buildup of glucose concentration in the blood, which is called hyperglycemia. Also, there is increased breakdown of body fat deposits as a source of energy. Now, this is called lipolysis. There is also increase of protein breakdown. Type 1 diabetes mellitus occurs more frequently in individuals who are carriers of certain human leukocyte antigens such as HLA-DR3 and HLA-DR4 due to their genetic disposition. Thanks for watching.